All right. Good morning, everybody. I'm Helen Evans and I'm on the executive of the Australian Global Health Alliance, and I'd like to start by acknowledging the traditional owners of the land on whom we meet, the people of the Kulin Nation, and pay my respects to their wisdom and knowledge and to their ancestors past, present and emerging. It's my great pleasure this morning on behalf of the Australian Global Health Alliance, which hosts the WHO Collaborating Centres Network, to welcome Dr. Saia Piukala to Australia, but also to this meeting, and to congratulate you on your recent appointment. In early 2017, when the Alliance was really just starting to go, and the network was an idea we had, but not yet developed, one of your predecessors, Dr. Shin, came and spoke to us at a breakfast. And he said at that time that there was a triple burden of disease in the Wipro region, and that was infectious diseases, NCDs, and climate change. And then when I listened to you, Dr. Piukala, on Monday, you said similar things. You said, if I get it correct, you said, long and healthy lives, climate change, and lessons for the pandemic were going to be your priorities. But you said something else that was really important, and that was that you want to talk about new ways of working, and I think that's really important. But without further ado, I'm going to hand over to my friend and colleague, Philippa Hetzel.
Thank you, Helen, and welcome everyone. And I would also like to start by acknowledging traditional custodians of the lands upon which we meet, the people of the Kulin Nation, pay my respects to elders past and present, any Aboriginal Torres Strait Islander people who may be with us, or First Nations people here today, and note the land was never ceded. So my name's Philippa Hetzel, and I'm one of the co-chairs of the WHO Collaborating Centre Network here in Australia. And we're delighted to welcome you here today with the Global Health Alliance to our breakfast meeting. You may not be aware, but WHO started creating collaborating centres back in 1949, and there are now 800 centres worldwide. But what is a collaborating centre? So actually I need to, here we go. What is a collaborating centre? It's a globally oriented centre of excellence, which has been designated as such by the WHO. And the centres have expertise in technical research, in implementation science and training, and they enable delivery of WHO's mandated work program objectives and help develop and strengthen institutional capacity in countries and across regions. WHO collaborating centres really enable the WHO with their decision-making. They help influence policy, they build capacity in government and non-government bodies regionally, and importantly, they really provide advocacy around key health themes. The Australian network of WHO collaborating centres was created back in 2019. And its purpose is to raise the profile and influence of Australia's WHO collaborating centres, to enable the sharing of knowledge that's embodied within those centres, and to strengthen the networks both between and beyond them. We have a network executive team of WHOCC directors, and they're representing centres across Australia. They're very passionate, and a number of them are here today, and they're really wonderfully supported by Cindy Milford, our network coordinator, who's also here. Cindy, put up your hands so everyone can find you in case. And if you are a WHOCC director here, we would love to have a photo with you with Dr. Piukala at the end of the session. As Helen mentioned, the network was enabled by and is hosted by the Australian Global Health Alliance. And that's been a really important and sustaining relationship for the WHO Collaborating Centre Network. And together, I guess our purpose, common purpose, is to promote health and keep the world, including the planet, safe and serve the vulnerable. So about the network. There are 54 collaborating centres in Australia, and this is the third highest of any country and the highest per capita and per member state globally. So something of which Australia should be very proud. And the 54 centres that make up the network are hosted by a range of larger and very different types of organisations, including universities, medical research institutes, government agencies, hospitals, not-for-profits, or combinations of all of those types of institutions. And this map shows you where they are. The centres, and as such the network, has a remarkable global reach and across well over 70 countries, covering all WHO regions. From Australia, obviously most efforts are focused in our local Western Pacific region and the Southeast Asian region, but a number of the WHO collaborating centres actually report directly through to Geneva as well, or work directly with Geneva primarily, and work right across the Wipro and Sierra regions in addition. So with a global reach extending far beyond Australia, in many instances, their profile may actually be stronger internationally than it is their recognition in Australia. Importantly, the centres have strong, unique and trusting partnerships right across the region. And these partnerships and trusting relationships are absolutely essential to their work with country ministries of health, with WHO officers, with other agencies, in efforts to understand the unique challenges in each area, as well as to respond in a way that is led by the community, that is sustainable and is customised for the circumstance. It's probably fair to say that the Australian network remains underutilised by our own Australian government. But there is a really wonderful opportunity here to leverage the diverse and in-depth expertise and capability of all of our centres. One of our deliverables that the network has achieved has been a large-scale capacity mapping project in which we actually asked all of the centres to be providing information about what it is that they do, that we could learn for the first time about what the true capability of the network is. And there's a report which is on the website which outlines our expertise, our partnerships, the breadth and extent of the experience and knowledge. The report is available and remains a living document and will continue to be updated so that it is there as a resource that people can search and look for. The work of the centres, as you'll see, expands across many different areas of public health and include climate change, vaccination, midwifery, diagnostics, workforce, regulation, system strengthening, infectious, neglected, tropical and non-communicable diseases, health promotion, etc., etc. And as such, the centres really possess and use a very broad range of public health skills. And the network aims to strengthen those linkages and cooperation between individual collaborating centres, the WHO and government. And we regularly participate in regional and global health meetings, workshops and particularly educational activities. So in conclusion, the network's value lies in the depth and breadth of its footprint in health locally, as well as its deep global knowledge and health intelligence and relationships. The WHO collaborating centres each have very strong links back to the WHO and its different regional offices, and they offer opportunities to link with academic and scientific trade partners globally. The centres and the network as a whole really add to Australia's contribution as a centre of medical research and innovation. There are significant opportunities and interest within the network itself to share knowledge, support work programs and collaborate together. And we welcome you to use the QR codes that you will find at various parts of this presentation, both to subscribe to our e-zine, we have a quarterly newsletter, but also to link back to our website and find out and learn more about the WHO collaborating centres. So it's my pleasure now to invite Hayley, my co-chair of the network, to introduce Mr. Piukala.
Thank you, Pip, and welcome everyone. I am thrilled to welcome to the stage Dr. Saia Ma'u Piukala, the Regional Director for the WHO Western Pacific region. Dr. Piukala is the first Pacific Islander to become Regional Director, but I'm sure he won't be the last. He's a politician, a public health leader, and a surgeon with nearly 30 years' experience working in Tonga and across the Pacific. He's a champion of multi-sectoral collaboration to tackle a cause very close to my heart, NCDs, and health threats posed by climate change. He has led initiatives to achieve universal health coverage and address emerging infectious diseases. He has been a strong advocate for youth health, tobacco control, safe surgery, and disaster preparedness and response. Representing more than 1.9 billion people across Asia and the Pacific, Dr. Piukala has had a very busy first few months in office, visiting many countries already across our region. And we are really honoured that he has made the time to join us today to share his hopes for our future, achieving better health in our region and beyond, and how we can collaborate together to support these efforts. Thank you so much, Dr. Piukala.
Good morning. I'd like to acknowledge the traditional owners of the land on which we meet today, the people of the Kulin Nation, and pay my respect to elders past, present, and emerging. Good morning, Professor Helen Evans, Dr. Philippa Hetzel, and Haley Jones, and everyone who are here this morning, especially to all of you from the WHO Collaborating Center. I'm very excited this morning and it's a pleasure for me to meet all of you here in Melbourne during this World Health Summit, and to take this opportunity to connect while we are here. Today is my 84 days in office. So I'm still new and young to this role, but I'm very excited to take on this role. And I don't pretend coming here knowing all that is needed to be done. I intend to listen, counsel and guided by member states and all of you who are here this morning. As the first Pacific Islander to be in the role of regional director after 75 years, it's not easy. Because if I'm not successful, they will blame me. Yeah. So I need to be successful. I need to success in this role, and I need your support and your help. So for the first 84 days, I have visited 9 member states, and Australia is the 9th. So I'm glad that I have fit in Australia in my first 100 days. And all these visits, we have visited Korea, Japan, China, Honolulu, Fiji, Samoa, American Samoa, Canberra, and today we are here in Melbourne. At many of these stops, I have had the privilege of meeting with our WHO Collaborating Center and getting to know them and to know you better. I think our collaboration center is very vital. As many people have referenced here at the World Health Summit this week, no one organization can do everything on its own. The WHO Collaborating Center are an important extension of WHO family. leveraging on the expertise we have around us, around the world, to help disseminate information, standardize practices, and conduct research, and so on. As the other members have mentioned already, Australia makes a great contribution to the WHO Collaborating Centre community, with 54 collaborating centres, making it one of the highest per capita out of all the member states. Across the region, WHO and member states regularly turn to Australia for advice. With its incredible strength in medicine, science, and technology, our member states look to Australia to share its expertise as a leader in these areas. And you are all perfectly placed to support that. We are particularly grateful for the work of the Australian network of the WHO collaborating centres. Having a formal network set up means that it's much easier for us to connect and collaborate with you all as a whole. So our thanks goes to Selena and the team for helping with that. I understand that many of the Australian WHO collaborating centres were actively involved in the development of For the Future vision, WHO in the Western Pacific previous vision for health in the region. We are continuing to build on the good work started there in consultation with member states and partners, and we are now working on the new vision that builds on the previous efforts and attempts to capture some areas which previously didn't receive enough attention. As I have said in my remarks on Monday, that I have identified 3 thematic priorities for my first 100 days. To promote an integrated approach to health systems development uses primary health care to achieve universal health coverage. Second, to accelerate action on climate change and health. And this is the threat that affects us all. And third, to build on the lesson of the last pandemic before the next one arrives. Achieving that vision, I need your support. And I'm grateful that I have 54 collaborating centres here in Australia that will support achieving that vision. As I mentioned in my remarks on Monday, we need a new way of working, and that's what we are trying to implement now. Country focus, delegation of authority, so that the country offices respond better, timely, to the needs of member states. And I think that's the game changer for WHO. And I look forward to learning more about your work and our future collaboration. And I welcome the opportunity to further strengthening and exploring new avenues for cooperation as we work together to enhance health and save lives in the Western Pacific. I'll just keep this short because I want to listen to the work that you do and how we continue and to strengthen our collaboration to save that 1.9 billion people, that at the end of the day, that all of us who are here in this room make a difference in the life of those 1.9 billion. I cannot do it on my own. No organization can do it on its own. We need each other. We need everybody's contribution. We are stronger together. And I wish you all the best, to all the WHO collaborating centers, the 54, all the best, and looking forward for a close working relationship now and the future. Thank you.
Thank you so much, Dr. Piukala. We have many of our collaborating centres in the room, and everyone's been very excited to meet with you. And I know we have a few questions from some of our centres and some of our members of the Global Health Alliance. So Dr. Piukala's kindly going to, I think maybe up here might be a bit easier. We'll just get some microphones around the room and give people an opportunity to, if you could introduce yourself and, if relevant, your collaborating centre or institution, and then we'll take a couple of questions and then we'll provide an opportunity for some answers. So do we have some volunteers for the microphones in the room? Great. Already organised. Fantastic. So before I open up the floor, we did have a question from one of our members who wasn't able to join us at this meeting, but is very pleased to be able to participate. This is Professor Susan Sawyer, who's the Director of the Centre for Adolescent Health at the Royal Children's Hospital, which is a WHO collaborating centre for adolescent health. And her question relates to her subject area on adolescent health, which is pointing out the importance of developing a regional strategy to advance adolescent health. And she's noted that the WHO Southeast Asia Regional Office has committed to developing such a strategy. And she finds that that's an important step to future investments in developing leadership and capacity to advance adolescent health country by country. And Susan is interested to know whether Wipro has any plans for a similar strategic initiative to address adolescent health. So that's one of the questions we'll be asking for Dr. Piukala, or perhaps for his team. He can give some of the questions across to his team as well, of course. But if there are any other questions from the room, please raise your hand and we'll take a couple and then we'll provide an opportunity for a response. I think we've got one up here at the front and then one over there. So we'll take these two and then we'll come over here, if that's all right with you, Dr. Piukala.
I thought I was the one that supposed to ask the question.
We can do that too.
You've been unfair on me. I said this is my 84 days in the job. I wanted to listen and to what the collaboration said and have a better understanding of the work that you will help. But I didn't get the... I'll ask my team for the first question on...
Good morning. Sunia Soka is Strategic Advisor to the Regional Director. Like my Regional Director, I'm young in the job, so you have to bear with me. But in fairness, the UN sister organizations, UNICEF and UNFPA, there are clear demarcations between the work we do. And with regard to adolescent health, UNICEF is the lead agency, and we play a supporting role. But we'll take on board the question that's been raised and look into it for our respective teams. Laura, would you like to add?
So, hi everyone, Laura Davison. I know many of you actually already from your collaborating centre work, so thank you. I think I'm really glad that we got a question from Susan, and sorry that she couldn't be here because she's such a great supporter of the Australian collaborating centres and a key voice. I know she's very passionate in adolescent health, and I think the work that she's doing as a global collaborating centre is really important. And Sierra is taking some really great strides towards adolescent health, and I think that's great and something for us to learn about. So we don't have a plan for a specific strategy as yet, but it's something that we continue to consider about how we put into all of our policies and strategies, as well as how we address adolescent and child health in all of our work. But it's definitely an area where we can grow, and I think where the collaborating centres play a really key role in getting us there.
Fantastic, thank you. Okay, I think we had one question there, and then we'll have one question there. Yeah.
Ben Murray, I'm from Sydney, from the WHO Collaborating Centre in Tuberculosis. Dr. Piukala, I realize it's very hard to be put on the spot with questions around everyone's pet areas of interest. I should just say that regionally and globally, WIPRO is regarded as leading a solution finder for the global TB epidemic. So there's many good things happening in the region, and many other parts of the world that are looking to WIPRO as a leader in creative approaches to global TB control. But what I wanted to ask is, maybe it's a good time in your early scoping out of the next 5 years, 4 to 5 years, is whether WIPRO, we've got 2 billion people, but we also have got huge economies. Huge economies and lots of wealth trapped within the region. And we haven't mobilized regional investment in the health challenges of our region, whether there's any potential scope for WIPRO to consider activating a regional health fund, which could be something that is that brings people together at a very difficult time of growing global and regional tensions, but where we can all focus on health as a unifying factor for the region. I just wanted to hear if that's anything that's been considered or potentially on a radar screen of what could be achieved in the next 5 years.
Okay.
There's an investment round discussing at the moment that will happen in November. And during my visit, there's one of the issue that we are discussing with member states is the investment round, and having 1 or 2 of the member states to co-host, and that's basically looking at regional, as you mentioned. And I think that will be very important. We had a discussion with Australia, Korea. So there is a good look for the investment round. And we are hoping that we'll have 1 or 2 member states to co-host that investment round. Thank you.
Thank you so much. I think we've actually just got time for one more question. So I think up the front here, thank you.
Thank you. Dr. Piukala, it's a great honour to be with you, and thank you for joining us. My name's Associate Professor Adi Vias. I'm a public health physician and representing the other side of this continent, where in Western Australia at Curtin University we have a World Health Organization Collaborating Centre for Health Impact Assessment, which has now become the Centre for Climate Change and Health Impact Assessment. Doctor, you wanted to hear a little bit about our work, so if I can just share a bit about that with you. And I hope this is not a hard question. It's hard in terms of the existential challenge, but it'll come from the heart, I think, your response. So for 20 years, our collaborating centre with Professor Jeffrey Spickett, who wrote the Health Impact Assessment Guidance for Australia and many other countries, Asian Development Bank, World Health Organization as well, we've been in Mongolia working with sustainable development practices, both for the health sector and non-health sector. This is before the SDGs were a global goal. We've been in the Philippines looking at their processes, and they've got this wonderful new law that was enacted a year or 2 ago within their Universal Health Coverage Act to talk about health impact assessment as a way to embolden health promotion activities. And in Fiji last year, we worked on the Health National Adaptation Plan for Climate Change and Health, which is a great leap forward, although Fiji is already a leader in this space. So my question is this, and if I can frame it in terms of where we all come from. So the people of the Western Pacific region have navigated the stars, navigated their ecosystems, their natural and man-made environments, human-made environments, for millennia. For those of us who work at the intersection of climate change and health, we see this critical existential threat. It builds upon all of the other triple goals or triple billion goals, anything you want to say. So the question is this: how can we learn from the knowledges of the Western Pacific to tackle this issue collectively and in a way of solidarity, which is what you mentioned right at the end of your talk? I'd love to hear about the lessons that you've seen both personally as a practitioner in the field and then now in your role as regional director. Thank you.
I think everyone in this room, you all know that the Western Pacific region is one of the most diverse regions in terms of economies, land masses, and population. From the high income to the lowest income. For the biggest and Western Pacific region is has the most population among other 6 regions. The health challenges may be the same or similar, different in scale. This is when I talk about that we need country-led, country-focused, community-led comes in. You know, some of our solution for the priorities or the needs of member states, you need a local solution. We need to listen to them. You know, sometimes you develop a program and this is the funding to implement that. And that's ours, not the member states' solution. Because there's a lot of things that comes into play. You have the culture, you have the tradition, you have the communities. There are some, I think for lesson learned from COVID-19 is the importance of communities led. They take ownership of the situation. We sometimes look far for solution of things that we have, but the solution is within our families and the communities. And then you come from the biggest country talking about climate change. In big cities, it's air pollution. In small island development states, it's rising sea level. It's coastal erosion. And if you look at Green Climate Fund, they talk about this is multi-billion dollars available. And small island development states have been trying to get funding because their priority is the coastal erosion, is rising sea level, is the frequency of natural disasters. World Bank came up with a study. If you invest $1 US on preparation, you save $7 US in reconstruction. The question is sometimes we ask, why it is difficult for small island development states to get access. I remember Tuvalu one time was asked, and it took 4 to 5 years to get an answer from them. Trying to get the funding for small island development states is a struggle. And by the time it is approved, half of the island is eroded. So I think, I can put it, trying to get the fund is like Attendees trying to pull a tooth from a patient. But I think if those process is more friendly and we listen to member states' need, because it's different to address that. We all know about the impact of climate change on health we are seeing now. The resurgence of measles now. You talk about the Philippines, Malaysia, in our region. There's a resurgence. Immunization is very low. There was measles outbreak in the Pacific in 2019. In Samoa, caused almost 100. But we all know that no child should get sick or die from measles. Having 2 doses of the vaccine, you are well protected. But anyway, I hope I answer your questions. Thank you.
So, yeah, I think we'll stick with this one. So, Dr. Piukala, I think your wisdom is very important, and it is a good question, and it's this balance between, I think for the WHO collaborating centres, how can we help best, and how can we position and forge that help in a way that the member states welcome. And this is where the regional office is so important to broker and direct the areas in which we can be working. So forging those relationships, and for us here in Australia to understand how we can best be of most use to the needs and priorities of the member states, but even small areas within those member states. How do you see any change in the way, and this might come back to what you were thinking in terms of the way that we're working. Would you like to outline a little bit more about the changes that you might anticipate, or what we've done in the past that you think didn't work that you now wish to change?
Who is this one? Like I said, my 84 days doing listening, and in my 100 days, I make it as my observation, looking at how things are done and see what the change might come. And you all know that the WHO is a science evidence-based organization. And the lesson learned from COVID-19 that we need a strong WHO. There's no other organization who has the mandate from the member states. So when I went into the office, one of my reflection and my observation, the focus was at the regional office. And I think that's the one that we are implementing now, is to change that mindset from compliance-oriented into impact result. At the end of the day, we need to see the impact at country level, at the communities, and that's what is very important for me at the moment. You delegate some of the authority to the country office, increase their capacity, empower them, that they better respond timely to the needs. Because if the focus in the main office, then the help and assistance reaching the communities and county level will hinder our drive to have impact. And I think this is the importance of having the collaborating centers to assist WHO serving the member state. As I mentioned earlier, evidence, science evidence-based, and the collaborating center have it. The WHO technical side, we do have technical expertise to provide technical assistance to member states if they need. And that is why I said earlier that we cannot be successful without the collaborating centers around the world, not only Australia, but around the region. And I'm so glad that WHO have got good collaborating centers in the region. Thank you.
Okay, well, I think we'll need to draw this session of the discussion to a close, but of course we've got some time to finish our delicious breakfast, especially for the RD to have a chance to have some food. So thank you all for attending. A special thanks to WHO and to Dr. Piukala for making the time for attending today. On behalf of all of the collaborating centres and the Global Health Alliance, I'd like to express our support for your work, and of course express that we will be in solidarity with you over the next 5 years and seek to achieve all of those goals that you've outlined. So thank you very much, and if you could join with me in thanking the Regional Director.
Thank you on behalf of myself, Laura, and Sonia. Thank you to the collaborating centers for having us. It's a great pleasure to be here. And I do look forward to a close collaboration with all of you in the near future. So thank you.